Morning, everybody. Can you hear me? Yes. I think I'm going to need this because it's a very full room. Well, our guest of honor has arrived. So we're here to celebrate our first Daisy Award, and Erin Kirwan is our first Daisy here at Orange Regional. So congratulations. Happy Nurses Week, everybody, and to our nurses and our honorary nurses this week. I want to welcome Joe Kirwan, Erin's husband, her daughters, Emma and Aubrey, her mom, Tammy, her dad, Jerry, and her lovely in-laws, Sandy and Larry Kirwan. So thank you all for coming. So a little bit of how we got here today. The Professional Affairs Committee, of which I'm the chair, really struggled last year to find a recognition, a reward and recognition that was befitting Orange Regional. And as we're on our magnet journey and guiding our hospital to operational excellence, the Daisy Award was something that actually Ann Wanderling brought to us, and then many of us had seen it at the Magnet Conference. And the thing about the Daisy Award is that not only does it recognize nurses, but it recognizes the team. And while we can have one Daisy every month, anybody who's nominated also gets recognized with a pin. So it really promotes nursing recognition and nursing excellence. Also, the power of storytelling. How Erin came to be our Daisy was because a family took the time to write a very wonderful and powerful story. And those stories are what help us grow and become better with each time the story is retold. So if you would indulge me for a few minutes, I'm going to read a little bit about how the Daisy Award was started. And there's quite a lot of detail in here I don't want to omit, so please forgive me while I read. So why the Daisy Foundation was started. The Daisy Foundation was established in 1999 by members of the Patrick Barnes family. Patrick died at age 33 of complications of ITP, which is a blood disorder. Like many families, nurses see every day families who go through this kind of horrific loss. The Barnes family wanted to find a way to turn their grief into something positive and do something that would honor the very special man Patrick was. So, as they say over a very liquid dinner after Pat's death, they came up with DAISY, an acronym that stands for Diseases Attacking the Immune System. And DAISY always is in capital letters to remind us of how Patrick died. As they brainstormed what the foundation would do, they actually kept coming back to the positive thing that during Pat's 8-week illness, they realized the amazing care he received while he was in the hospital. Everybody who comes to the hospital expects to get excellent clinical care, but it's the people who go above and beyond that make the difference in their patient experience. As a result of their experience, the Barnes family believes that nurses are the unsung heroes of our society, who deserve far more recognition and honor than they receive. They decided to find a way to go around the country and say thank you to nurses. Pat's wife Tina, Diane, Bonnie, and Mark created the Daisy Award for Extraordinary Nurses. What started out as a thank you from our family to the nurses who took care of Patrick has grown into a meaningful recognition program embraced by healthcare organizations around the world. The last statistic I saw, there are about 13,000 daisies, and it's growing very rapidly, and it is an international award, much like Magnet. Now I'd like to invite Nicole, who's right here, if you would read Erin's nomination.
Thank you. Hi, everybody. Just want to say Happy Nurses Week to everyone. Give yourselves a round of applause. I'm going to read this letter from a family who nominated Erin for our Daisy Award. I just want to preface this by saying it's an honor for me to be able to give Erin this award as her boss, because I'm her work mama and I love her.
Okay. So Daisy provides, because often these are moving, Kleenex.
Try not to cry.
Oh, I'm sorry. I just realized. I forgot Scott. Scott, please.
That's all right. Go ahead. I'm not a nurse. I don't this light at all. But happy Nurses Week, everyone. Congratulations, all nurses. All nurses. Thank you very much. And I want to thank Teresa and her team for the wonderful decorations. It really is fabulous and festive. And we're honored at Orange Regional to have our first Daisy Award and have Erin as our first recipient. It's quite an honor for her and a pleasure for us to give out this great award. So this is the beginning sort of Nurses Week. We have big events, blessing of the hands with Deacon a little later this morning, and then we have tonight the Hudson Valley Magazine Nursing Excellence Awards. We have 4 nominees, right, for that, so they'll be very in the top 20, so it'll be a very exciting event tonight too, as well. So with that, I'm going to turn it back over to Teresa. Thank you.
My apologies.
Okay, I'm going to read the letter that was written for Erin. Okay. Last month, my mother came into the hospital for what would be one of her very last visits. After almost 4 years of fighting stage 4 breast cancer, she died on Saturday, March 22nd. While she was at ORMC several weeks earlier, the care and professionalism shown by the ORMC staff was incredible, not only helping the family to work through this difficult time, but also giving the gift of another month to spend with their mom. I would like to thank one staff member in particular, Nurse Erin Kirwan. My mother came to the ORMC ER and was quickly diagnosed with pneumonia. The prognosis was grim based on her already deteriorated condition from cancer. While it was clear that the attending medical staff, led by Dr. Alan Schaefer, were doing everything in their power to save her, with compassion, they guided my family through some very difficult talks. After finding out that we had not made a decision on a DNR, Nurse Kirwan gently educated us on our options. She also volunteered to have this tough conversation with my mom, as we knew that she would avoid the direct discussion with the family. I'm extremely grateful for both her guidance and tact. At another point during my mother's stay, her cell phone went missing. Under most circumstances, this would be a minor inconvenience and a form to fill out. But in this already stressful time, it seems like the stars aligned against us. Nurse Kirwan did everything she could to help us find it, literally tearing through trash and laundry. And she called me that day too. She really was. When it did not turn up, she contacted patient advocacy and initiated a claim. She did manage to find and return it. It was very clear to me and my family that Nurse Kirwan was interested in more than clocking a paycheck. I felt as if she genuinely cared for my mother and family. Though my mom is no longer with us, I know that she appreciated the kind care that Nurse Kirwan provided during the short time that she had left. I know that my family and I are grateful. She deserves all the awards and accolades. From Erin Kless.
And I did call Mr. Kless to tell him that because of his letter and the power of his story, that you are our Daisy, and he was thrilled. They live in Boston, so he was not able to attend, but we invited him to come. So congratulations.
Thank you so much. Thank you.
So on behalf of the Daisy Foundation at Orange Regional Medical Center, we proclaim you the Daisy Award for Extraordinary Nursing. And here is your award certificate.
Thank you.
And it says, the Daisy Award for Extraordinary Nurses. This award is presented to Erin Kirwan, RN, excuse me, in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people. And it's signed by our chief nurse, Joanne Ritter-Titel, and the co-founder of the Daisy Foundation. So, and knowing how much tradition nurses have in pins, the Daisy Foundation also has a pin for you to wear.
That's great.
And then also, the foundation wants you to have this sculpture.
Wow.
Gordon, can you grab the sculpture? Okay. So every Daisy recipient gets all of these items. And this sculpture is called the Healer's Touch. And each piece is hand carved by the foundation artists. It's from a tribe from Zimbabwe. And the foundation shows this beautiful design not only because it sensitively depicts the unique relationship you have with your patients, but also because the Shona people hold their healers in a position of great importance. And you also are eligible for a Chamberlain College Nursing Scholarship should you decide to advance your degree. I'm going to turn the mic over to Gordon for a minute. And last but not least comes the best part of the presentation, and it talks about food.
Okay. Thank you.
Hello, everybody. And once again, congratulations, Erin.
Thank you.
An award well deserved.
Thank you.
By definition, the Daisy Foundation thinks that all nurses are extraordinary, and we wish we had the resources to honor all of you individually. So, we try to say thank you in a small way by bringing Cinnabon cinnamon rolls to all nurses in a unit. After all, nursing is a team sport. And, as nurses who receive the Daisy Award often say, quote, everyone in the unit deserves this award as much as I do. The reason for Cinnabon rolls is that when Pat was ill and had lost his appetite, he asked for a bite of a Cinnabon that I had brought in the morning for my breakfast. Pat ate the whole thing. That night, when Bonnie and I were leaving the hospital, Pat asked that we bring him a Cinnabon roll the next day, and to be sure to bring in enough for all the nurses on the unit. As those Cinnabons were Pat's thank you and a gift of appreciation to his nurses, the Foundation wants these Cinnabons to also say thank you and express our gratitude for all nurses for the work you do every day. There is another reason why we bring Cinnabons. Almost without exception, when a nurse receives the Daisy Award, the humble response is, I don't deserve this. I was just doing my job. What the Daisy nurse may not realize, however, is that when nurses are just, quote, just doing their jobs, end quote, they have such an important and meaningful impact on the lives of so many people, many more than their patients. We have heard and read story after story in Daisy Award nomination forms that bring this to light. Shortly after we started honoring nurses, a nurse was nominated because when a physician was ready to discharge a surgery patient, a nurse felt that something just wasn't right with the patient's behavior. The doctor didn't find anything wrong when he examined the patient and reviewed test results, but the nurse was persistent. She knew intuitively that something still wasn't right. Finally, an MRI revealed a small leak in a blood vessel in the patient's brain, which was corrected through emergency surgery. Because this nurse, quote, just did her job, end quote, for her patient, this father was able to go home to his children. This husband went home to his wife. This son was able to see his parents again. This brother could spend more time with his siblings, etc. The impact this nurse had on the patient and his family was indescribable. More recently, a nurse was nominated by 2 fellow nurses for showing what a knowledgeable and caring individual she is, not only to patients and families, but to other staff members. One special moment was when an elderly man came in with an attempted suicide. The patient was unstable and on a ventilator with many drips. The patient's son was very distraught and blaming himself. After getting the patient stabilized, the nurse arranged for the son to see his father and explained some things to him before he went into the father's room. She hugged his son, and that seems just what he needed. Someone there for him during this hard time. The nurse provided his son with her cell phone number and told him that he could call her any time during the night for an update. She said she would call him at 7 a.m. to give him a general update on his father. After this, the son felt comfortable enough to go home. The impact this nurse had on her patient's son, not to mention the other nurses who witnessed her compassion and concern for father and son, is another example of a nurse quote, just doing her job. It should also be her or his job.
That's why we picked you.
Nurses, like the ones just described, are surprised when they receive the Daisy Award because to them, they didn't do anything special. That's why at every Daisy Award presentation, we ask each nurse to pause for just a minute and realize how very special they are and how they make the world a better place by just doing their jobs. Today, a nurse's job may entail saving a patient's life, applying training and skills to a complex medical procedure, or it may be a nurse's act of compassionate and kindness that makes a patient or family member feel a little better. No matter what the day brings, a nurse's impact is invaluable and long-lasting to their patients and families. So that's why we bring Cinnabon cinnamon rolls to every presentation. I don't know if anybody smelled them, but they're right over there. We ask that whenever you smell a Cinnabon cinnamon roll, whenever you taste one, whenever you think of one, or if you are baking with cinnamon at home, please remind yourself how special you are. Whenever you're just, quote, doing your job, and, quote, not doing anything special, you are making a positive difference in a patient's and their family's life. You are making the world a better place. You are very special. You are a nurse. The Daisy Foundation salutes you and honors you. Please enjoy these Cinnabons as Pat's gift and everlasting, quote, thank you for being a nurse, end quote. You are truly very special people.
So in closing, thank you, everybody. Thank you, Scott.
I'm sorry, I just want to say
Of course.
something.
It's very rare that I have such a big captive audience, so I wanted to just say a few words. Hold on, I have notes. Just 1 minute. Okay. Thank you. Yes. You know what, I put something together this morning while I was getting ready to come here. I had free time, and I wanted to apologize. I was late, I'm sorry. Thank you to everyone who came here for this award. It's really touching because I was racking my brain when I was nominated. Who could it have been? What family was I so nice to? What did I do that was above and beyond? I had no idea. I was speaking with Jen the other day, and I had an idea of who the family was, and it wasn't them. This floors me. This is, if you knew this family, this woman was suffering. She was not happy. The family wasn't happy. I left every day thinking, what could I have done better? I felt like there was nothing I could have done that would have made this family happy. So to have them write this letter is really amazing, to think that they were appreciative and they did realize we were only trying to do the best for this woman in the last days of her life. This is very, very meaningful to me. So I wanted to appreciate and say thank you to everyone who thought that this was a good idea. So thank you. Just briefly, I was hired 10 years ago in Horton. I did a year there, then I went to the emergency room. I always wanted to be a nurse. I always wanted to work in the emergency room, but no one has ever asked me why I still want to be a nurse. And since it's nursing week, I will tell you why. I'm still a nurse because I'm proud of this job that I do. I'm proud more than ever of the organizations that I belong to. It was in Horton in 2004 when I met my best friend working as a brand new nurse with 16 patients. I returned to school and graduated Dominican College in 2011 with my bachelor's thanks to the tuition reimbursement program. And in 2013, I needed a change in pace, and I went on a job interview, 8 months pregnant, and without any intensive care experience, Kim hired me. So I want to thank Kim for hiring me to intensive care. I love my job. I can't believe I like it as much as I do. I'm afraid to tell people that I like it because they're going to want my job. So thank you very much. Thank you, Kim, for hiring me. Thank you, Nicole, for keeping me. And happy Nurses Week.
I think Erin did a great job concluding our ceremony. And congratulations again, and happy Nurses Week.
Put out the Cinnabon.
All right. Wow. Thank you so much. Thank